Hey everyone, and welcome to today's Explainer. I'm a medical educator with the physiotherapy team right here at Westminster Multispecialty Clinic, located in the absolute heart of Dubai Healthcare City. Today, we're zeroing in on a highly common, yet honestly incredibly misunderstood issue: persistent shoulder pain. If you're an active person, maybe a desk worker who hits the gym hard, and you're just dragging around a shoulder that refuses to settle down, well, this explainer was built specifically for you. We're going to lift the hood on what goes wrong mechanically, and far more importantly, how we actually fix it. So let me ask you a pretty direct question. Have you been ignoring a nagging shoulder ache? You know exactly the kind I mean. It's that dull, annoying discomfort during a workout, and you just kind of tell yourself, oh, it's just gym fatigue. It'll fade, right? So many of us are wired with that active mindset where we think walking it off is the universal cure for everything. But here's the reality: not all shoulder pain is created equal. Mistaking a real structural issue for everyday muscle soreness, that's the very first misstep we see on the road to a much more serious injury. At Westminster Multispecialty Clinic, what we see with patients time and time again is that these injuries are rarely dramatic. There's usually no single pop or moment where something clearly snapped. Instead, it's the slow-building, creeping discomfort. It's the pain that flares up after a heavy gym session. It's waking up aching just because you rolled over and slept on your side. Or it's that sharp little pinch when you reach overhead to grab something off a high shelf. Because these symptoms are so subtle at first, they are incredibly easy to dismiss. People ignore them for months, all while the underlying problem is silently getting worse. Okay, let's dive into the anatomy for a second. When we talk about this specific type of pain, we're usually talking about the rotator cuff. Now, what's really fascinating here is that the rotator cuff isn't just one muscle. It's actually a highly coordinated sleeve-like structure made up of 4 specific muscles and their tendons: the supraspinatus, the infraspinatus, the teres minor, and the subscapularis. Together, their main job is to hold the ball of your shoulder joint firmly in its socket, all while allowing that incredibly wide range of motion your arm is capable of. Literally every single time you lift, rotate, or reach, these 4 guys are actively engaging. But there is a weak link in this chain. Let's focus in on the supraspinatus tendon. This is by far the most commonly affected tendon we treat. Why? Well, anatomically, it runs through a very narrow channel between your shoulder bones. Imagine trying to pull a thick rope back and forth through a tiny metal ring. When you do repetitive overhead movements, whether that's heavy shoulder presses in the gym, swimming laps, or playing tennis, this specific tendon is put under a sustained accumulating load. It gets compressed, it gets pinched, and over time, that friction actually causes the tendon fibers to begin to break down. And over time, this wear and tear builds into an actual physical injury. Broadly speaking, we see 2 categories. The first is acute tears. These are the obvious ones. You fall on an outstretched arm, take a direct hit, or you do a heavy lift with poor mechanics. It is immediately painful. But the second category, degenerative injuries, are far more common and honestly much more insidious. This is the repetitive loading and gradual wear down over months, maybe even years. What we frequently see with our active Dubai patients is that they simply adapt their workouts around the pain. They alter their form rather than addressing the actual degenerative wear. Which brings up a major factor we absolutely cannot ignore: age. To put this into perspective, around 30% of adults over the age of 60 have a rotator cuff tear, and those rates rise sharply as we get older. This is highly relevant in a dynamic city like Dubai. We have a fantastic culture of active adults who continue heavy weight training, tennis, and golf well into their 50s and 60s. The issue isn't the activity itself. The issue is continuing that heavy load without adjusting for the natural mechanical changes and tendon vulnerability that just come with aging. So how do you actually know if this is what you're dealing with? Well, here is the exact symptom checklist our physiotherapist team at Westminster uses to help patients recognize it's time for a proper clinical assessment. Look for pain in the front or side of the shoulder that might even spread down the arm. Notice if you have a painful arc of movement. That's usually a sharp pain when your arm is raised right between 60 and 120 degrees. Pay close attention to night pain, especially when lying on that side, and listen for any clicking or catching sensations in the joint itself. But the absolute crucial takeaway here is a very specific combination: pain plus weakness. Look, shoulder pain by itself can originate from a dozen different sources: neck tension, bad posture, minor strains. But when you have shoulder pain combined with noticeable weakness when you try to lift your arm out to the side or overhead, that is a highly specific signal. It points directly to a rotator cuff issue. It is the undeniable red flag telling you that just resting for a few days is not going to magically cure this underlying mechanical failure. Which brings us to a mindset we encounter constantly: no pain, no gain. We completely understand the drive of an active person wanting to train through the discomfort. But we have to look at why doing that with a rotator cuff injury is so biologically dangerous. This isn't a simple muscle belly that you can just flush with blood by doing some light pump work. This specific injury simply does not forgive the push-through-it approach. Here's the biological reality of the situation. Rotator cuff tendons have a naturally limited blood supply compared to your muscle tissue. And remember, blood flow is what brings the nutrients required for cellular repair. Because these tendons have poor circulation, they're kind of like a desert trying to grow a plant. They heal very slowly, and they have an incredibly low tolerance for ongoing stress. If you keep lifting weights or playing sports on a compromised, inflamed tendon, you aren't toughening it up, you are physically increasing the size and the depth of those microscopic tears. At Westminster Multispecialty Clinic, our team's approach is grounded in honest, direct clinical reality, and the stakes are pretty clear. If we catch a partial tear early, we can usually manage it with conservative recovery, meaning targeted physiotherapy and proper rest, entirely avoiding the operating room. But if you take that exact same injury and you stubbornly push through it in the gym for another 6 months, you significantly increase the likelihood that it becomes a full tear. You literally transform yourself from a straightforward physiotherapy patient into a surgical candidate. Okay, let's pivot to the solution. When you walk into our clinic, you aren't just handed a generic printout of exercises. We map out 3 distinct steps for a highly personalized rehabilitation journey. Step 1 is the detailed assessment. Step 2 focuses purely on pain and inflammation reduction, just to calm that irritated tissue down. And step 3, well, that's where the real structural rebuilding happens through progressive strengthening and scapular control. Let's look at step 1, because getting the diagnosis right from day 1 is everything. A detailed assessment means our specialists don't just say, "Yep, you have shoulder pain." No, we identify exactly which of those 4 tendons is damaged, how much function has actually been lost, and crucially, we pinpoint the exact movement patterns or training habits that cause the overload in the first place. Doing this allows us to build a structured treatment program perfectly suited to your specific anatomy and your target activity level. Once we move into the recovery phase, we start with gentle mobility, just to let the tendons settle. But here is where the magic really happens: correcting scapular control. Your scapula, your shoulder blade, is the absolute foundation that your rotator cuff operates from. If your scapular control is poor, which by the way is a massive underlying factor we see in gym goers, your rotator cuff is basically being forced to work overtime in terrible mechanical positions. Restoring function means we train those stabilizing muscles, so you don't just heal now, you prevent re-injury later. And we don't just stop at the shoulder. Our team utilizes general musculoskeletal physiotherapy to take a really holistic look at your biomechanics. Very often, a rotator cuff issue is actually the victim of problems somewhere else. We address poor desk posture, rigid upper back tightness, and chronic neck tension. Think about it. If your upper spine is locked up, your shoulder joint compensates, completely altering how it loads during activity. Fixing the whole chain is how we ensure long-term pain-free movement. I want to leave you with this empowering clinical truth. Catching it early makes all the difference between conservative rehab and surgery. If you've been managing shoulder discomfort for longer than a few weeks, or if you're starting to notice that specific combination of pain and weakness we talked about, the physiotherapy team at Westminster Multispecialty Clinic is here to give you a clear, structured path forward. So ask yourself, is your shoulder discomfort just a minor annoyance, or is it a ticking clock? Don't wait until gym fatigue becomes a surgical reality.